Thank you, Chairperson, for the kind introduction, and thank you, Professor V.Mohan, for giving me this opportunity to speak on this topic, which was very much close to my heart, and a bit of controversies also there in this topic. When we talk about the functional foods in type 2 diabetes, a lot of thoughts are coming up in our mind. But most of the time, we see that what is the functional foods is very difficult to define. Yesterday, one of my editorial has been published. First of all, I must say that there is no conflict of interest for this talk. Audience can click the pictures of presentation wherever they like. So yesterday, one of my editorial has been published in a journal, and it was just a coincidence that I was speaking here and this publication came up, and this was very much easy to me to put my point better if I can share this editorial. So I have shared this editorial in the group of speakers also. If anybody wants, we can share it to you also. For the first time, RSSDI tried to put its foot in the controversial topics also, and we entered in the guidelines making for the nutrition in the diabetes, and it's this guidelines 17, chapter 17 is covering the functional foods in type 2 diabetes and its importance. And I'm also the part of the guidelines, and chapter 17, I'm also the author of that. So let's come over to the topic. What are actually the functional foods? They could be natural, they could be processed, but they must be containing known or unknown biological active compound, which may be providing clinically established health benefits for chronic disease, prevention, management, and treatment when consumed in defined practical non-toxic qualities. Source could be plant, could be animal, could be dairy products. Functional foods may improve oxidative stress, reduce inflammation, they reduce insulin resistance, reduce glucose absorption, improve insulin secretion, and enhance lipid profile. So they can definitely play a very good role in management of the diabetes, especially when we face challenges despite giving the medicines. Let's come for the Ayurvedic connection. Whenever we talk about the Ayurvedic connection, many people say that what are you going, you are drifting towards the another kind of the therapy. So I must say here, this is not the another kind of the therapy. Ayurveda was the ancient part of the current therapy. It is the mother of modern medicine. So once we were not knowing the qualities of the molecules and its capacity to control diabetes, the Ayurveda has discovered various food items, various day-to-day items which could be supportive in management of the disease. And those items were very much prevalent those days, and they have been carried forward by our ancestors even towards the previous few generations. But now we are dependent completely on the molecules and their chemical properties, which helps us in prevention and treatment of the disease. Now question arises, if these molecules would have been that time, then probably the discovery of these properties of those content would be very much difficult. But now we know that these food items are having some properties which can help in management of the disease. We can align them with the current modern therapy. We can align them with the molecules, with their properties, whatever they are doing, and they can help us without causing any additional harm or any additional toxicity or any additional side effects. So this is called as holistic approach. There are certain powerful spices in our daily food items like turmeric, fenugreek, cinnamon. Turmeric is having anti-inflammatory property, everybody knows, and diabetes is having its role in through the inflammation. Its insulin resistance is coming up through the inflammation. So it helps in reducing the inflammation. Fenugreek has been tried and tested by many workers, many researchers even in India. Professor S.V. Madhu has worked on the fenugreek also a lot. So this seed contains galactomannan, disogenin and 4-hydroxyisoleucine. Soaking 2.5 to 15 gram of the seeds overnight improves glycemic control and increases insulin sensitivity. Cinnamon, that contains limonoids, terpenoids, alkaloids, and polyphenols that can reduce fasting blood sugar by 2 to 111 and HbA1c by up to 1.2% at doses 0.5 to 6 gram daily. Quite significant HbA1c reduction it is there. Ginger and garlic. These are the kitchen staples with medicinal power. Ginger, rich in phenolic compounds, contains lipids, polysaccharides, terpenes, and organic acid, significantly reduces the fasting sugar, HbA1c, and blood pressure. Effective at the doses of 1.6 to 2 gram daily. Garlic contains allicin, allicin, diallyl sulfide, and 5-allyl cysteine. It lowers blood glucose levels, improves lipid profiles, affects total cholesterol, LDL, and HDL levels, effective at the doses of 0.9 to 1.5 gram daily. Bitter gourds. It is nature's insulin. Many of the people were trying to replace it with the medicines, but this cannot be the replacement of the medicine, but could be supportive of the medicine because of its few property. One of the most powerful vegetable for the diabetes management that contains polypeptide. It is a natural insulin-like compound. Carnitine enhances the glucose uptake and glycogen synthesis. Alkaloids, glycosides, saponins, and flavonoids. Lysine that helps reduce the blood glucose level. Another very important molecule, fenugreek. As I already said that Dr. S.V. Madhu and myself has also worked in this fenugreek. This is water soluble, 40% furanolonic saponins is the content of the fenugreek. We conducted a clinical study to demonstrate its efficacy in 154 subjects aging 25 to 60 years for 12 weeks. What we could find, this has been published in the Index Journal, that time-dependent effect of the fenugreek seed extract containing 40% furanolonic saponin on fasting plasma sugar was found to be clinically as well as statistically significant in 90 days. And same effect we could see on the postprandial plasma sugar also. Time-dependent effect of the fenugreek seed extract, which was containing 40% furanolonic saponins, has also been seen on the fasting C-peptide. Although postprandial C-peptide was not found to be having a clinically and statistically significant effect, but fasting C-peptide was found to be having its effect. The same molecule has been tested for the infertility as well as for the, in fact, the erectile dysfunction. Testosterone level was found to be enhanced. This work was also done by my team and it has also been published in international journal. The mechanism of this is protodiazine is the content of the fenugreek, which is supposed to increase the testosterone level. By doing that, it increases sexual functions directly. But at the same time, this also helps in conversion of the testosterone into the dihydrotestosterone that improves the erythropoiesis with muscular development. So this is also helpful in the athletic activities also. It increases in hemoglobin level and through that also it provides the optimal health and ultimately again helps in the increasing sexual function. Free testosterone and total testosterone level following supplementation of the fenugreek seed extract enriched in 20% protodiazine was found to be significant as far as the free testosterone is concerned. Although we could not find with the total testosterone the level of the statistical significance. In fact, we could see that sperm count, sperm motility, and abnormal sperm morphology could have been corrected in a study which have been conducted up to the 12 weeks of these fenugreek seed extract enriched in 20% protodiazine treatment. Few more medicinal herbs with anti-diabetic properties like amla, tulsi, jamun. Amla is rich in phenolics. Phenolic fractions lower the gene expression for hepatic gluconeogenesis. Tulsi contains the oleanolic acid, ursolic acid, rosmarinic acid and eugenol that help enhance insulin sensitivity and reduce inflammation. Jamun, rich in gallic acid and other phytonutrients that assist in accelerating glucose transport into cells and fostering better overall health. There are certain leafy greens with glycemic benefits which are natural content of our kitchen, like curry leaves, which is very commonly used in South India and North India both, but more in the South India. Drumstick leaves, more used in the South India more, mulberry leaves, and they all contain the polyphenols, alkaloids and flavonoids, including mahanin, mahaimbine and coimbine that helps regulating the blood glucose level, and it can also be found to be useful complementary mealtime glucose option for patients with type 2 diabetes. Let's have some few words about the green tea, lemongrass, sumac. These are, for example, if we talk about the green tea, it is rich in catechin, polyphenols that helps improve insulin sensitivity and reduce oxidative stress. Regular consumption has been linked to better glycemic control. On the other hand, a lemongrass has been found to be helpful as it is having antioxidant properties, reduces the long-term risk of the diabetic nephropathy by suppressing hyperglycemia and improving serum parameters. Sumac provides a beneficial effect by preventing glycogen accumulation in the proximal tubules and improving glucose, glycosylated proteins, and blood urea nitrogen levels. Whole grain, these are the foundation of the glycemic control. Like rich nutritional profile they have, whole grain contains the soluble and insoluble fibers, inulin, beta-glucan, resistant starches, carotenoid, phytates, phytoestrogens, and phenolic acid. These components support the glycemic response, insulin sensitivity, pancreatic beta cell function, and reduces the oxidative stress. Brown rice has got its own advantage, offers benefits over the white rice due to gamma oryzanol minerals and natural pigments like anthocyanin. Germinated brown rice exhibits promising anti-diabetic properties. Millets, a lot of talks are being done on the millets, and people are focusing millets like a savior for the metabolic diseases. Millets, which is also known as the Shri Anna, are rich in fiber, antioxidants, polyphenols, phenolic acid, flavonoids, tannin phytates, anthocyanin, calcium, sulfur-containing amino acids, and omega-3 fatty acids. These components help reduce inflammation and improve the glycemic control, although more studies are required to be done on that. Pseudo cereals, they are the nutritional powerhouse like buckwheat, amaranth, bamboo rice. These pseudo cereals have been associated with reducing inflammation and improving glycemic control due to their unique nutritional profile and bioactive compounds. Legumes, protein-rich diabetes allies. Beans, which are rich in the dietary protein, fiber, and antioxidant that help control blood glucose level and improve insulin sensitivity. Soya bean, rich in the phytoestrogens and bioactive peptides, with anti-inflammatory and lipid-lowering properties. Lentils contains the bioactive phenolic compounds that help control LDL cholesterol level and manage hypertension. Peanuts provide healthy fats, protein, and fiber that help maintain stable blood glucose levels and improve the satiety. Colorful fruits and vegetables like tomatoes, berries, and apples, which are the natural ingredients of our food. Tomatoes rich in lycopene, we all know that. Chlorogenic acid that helps reducing inflammation and improving the cardiovascular health in diabetes. Berries, repository of the antioxidant, fiber, vitamins, and phytochemicals that improves glycemic control and reduce oxidative stress. Apples contain procyanidins and fibers that help reduce the triglyceride levels and improve cardiovascular health in diabetes management. Jackfruits and unripe banana. Very few people are knowing the properties of the jackfruits and unripe banana. Jackfruit flour has exhibited glucose-lowering effects. It can reduce the fasting blood sugar by 29.45 milligram per deciliter and HbA1c by 0.25%. Unripe bananas are high in resistant starch that acts as a prebiotic. Raw banana flour can decrease the glucose level, helps restore body weight loss, and reduce feed intake. Considered a functional food ingredient that may reduce risk of the non-communicable diseases. Probiotics and gut health. We all understand, and a lot of talks has been heard by many of us given on the multiple forums about the probiotics and gut health as well as its impact on the metabolic disorders. Yogurt, fermented dairy products, alter gut microflora and may reduce gut dysbiosis in diabetes. Garlic, onions, bananas provide prebiotics that support the growth of the beneficial gut bacteria. Beneficial bacteria like probiotics, Lactobacillus acidophilus, Lactobacillus casei have shown positive effects on the glycemic control. Maintaining gut health through probiotics has been linked to the better glycemic control and improves lipid profile. Dairy products and diabetes prevention. Systemic reviews have found that dairy consumption is associated with reduced incident diabetes, lower hypertension risk, decreased metabolic syndrome prevalence, lower overall mortality, and they help in preventing the incidence of type 2 diabetes as well as their associated risk. If we talk about the omega-3 fatty acids, this is balancing the inflammation. 3:1, the recommended ratio, but most of our foods are having the ratio 15:1. So we need to increase the omega-3 fatty acids as compared to the omega-6 fatty acids. Modern diets often have ratios 15:1, contributing to the inflammation. High EPA ratio is promising indicator of better glycemic control and reduced inflammation. And 2 to 3 servings of the fatty fish weekly recommended amount to improve the cardiovascular health and reduce inflammation. Seeds which are rich in omega-3 fatty acids, many people, those who are not ready to take fish, strict vegetarian, they can consume the flaxseed and chia seed. Flaxseed rich in alpha-linolenic acid, a type of the omega-3 fatty acid, contains lignans that inhibits oxidative stress, helps show down the advanced glycemic end products, reduce beta cell dysfunction and apoptosis, lowers the blood pressure and blood lipids. At the another end, chia seeds have been found to be containing polyphenols, chlorogenic acid, also rich in quercetin, camphorol, epicetin, rutin, helps improve the glycemic control and lipid profile. Nuts, these are the nutritional powerhouse. Almonds, rich in protein, fiber, healthy fat. Studies show almonds can improve the HDL cholesterol, reduce insulin resistance, and in Asian, Indian, and cardiometabolic risk. Asian Indians with cardiometabolic. Walnuts, excellent source of the omega-3 fatty acid and oxytocin that helps improving the cardiovascular health and reduce the inflammation in diabetes. Cashews, research found that cashew consumption increased HDL cholesterol and reduces systolic blood pressure in Asian Indian with type 2 diabetes. An intake of 28 gram of the day of the tree nuts can reduce blood glucose and HbA1c level. However, be aware of the potential allergies and adverse reactions. Blue-green algae, emerging functional foods. Blue-green algae spirulina contains numerous beneficial compounds, polyunsaturated fatty acid, polyphenols, sterols, proteins and sulfated polysaccharides, potent antioxidant, essential amino acids like leucine, valine, isoleucine, tryptophan, methionine, phenylalanine, theanine, lysine. These components improve glycemic control, reduce inflammation associated with diabetes. Herbal products for hyperglycemia management: cinnamon, fenugreek, bitter gourd, amla. I have already told that they are helping us a lot in reducing the glycemic load as well as improving the HbA1c too. It's fibers which are essential for glycemic control, 25 to 30 gram. 20% soluble fibers slows the digestion and helps control blood sugar spike after meals by forming a gel-like substance in the digestive tract. 80% insoluble fiber adds bulk to the stool and helps food pass more quickly through the stomach and intestine, improving gut health. So this ratio should be in 80-20. Comprehensive approach to the diabetes management starts, obviously, the diet management and diet is the first thing to be handled with diversities. Diverse diet should be included in our day-to-day routine. Functional food should be given the priority. Regular physical activity is must, and medical supervision and lifestyle modification, which were the part of the already existing algorithm, should continue as such. So clinical pulse for the practice. Spice integration. Indian spices, condiments and vegetables rich in plant sterols, stanols offers an array of flavors and nutritional benefits that aid in managing diabetes, lipid profile and overall health. The ingredients discussed can be easily incorporated into day-to-day cooking, which would not only help to add to the nutritive value of the food, but also lower the glycemic index or glycemic load of the meal. Balanced nutrition is important part of the advice. Use of the fiber-rich foods, omega-3 fatty acids, antioxidants, and good quality dietary protein under the supervision of a nutritionist is warranted for diabetes management. Synergistic approach is combination of the food groups along with the incorporation of the functional foods in daily diet may help in optimizing the health of people with diabetes through synergistic interaction. But we should always keep remember these functional foods are supportive to the treatment, not the replacement of the treatment, and this must be taught to our patient and the public that they can help you keeping your glucose level up to the optimum level, but they cannot replace the medication what is being prescribed. So this has been the very old saying by the Hippocrates, let food be thy medicine, otherwise you will have to eat the medicine like food. So we should take care of this. We are entering into the era where we need to eat the medicines like a food. So if we can take that advantage from our food, it would be really great for all of us. Thank you very much for your kind listening.